internal jugular vein is a large vein that receives blood from the brain, face, and neck. It starts as a continuation of the sigmoid sinus and leaves the skull through the jugular foramen. It then descends through the neck in the carotid sheath lateral to the vagus nerve and the internal and common carotid arteries. It ends by joining the subclavian vein behind the medial end of the clavicle to form the brachiocephalic vein. Throughout its course, it's closely related to the deep cervical lymph nodes. The vein has a dilation at its upper end called the superior bulb, and another near its termination called the inferior bulb. Directly above the inferior bulb is a bicuspid valve. Relations of the internal jugular vein. Anterolaterally, the skin, the fascia, the sternocleidomastoid muscle, and the parotid salivary gland. Its lower part is covered by the sternothyroid, sternohyoid, and omohyoid muscles, which intervene between the vein and the sternocleidomastoid muscle. Higher up, it is crossed by the stylohyoid, the posterior belly of the digastric, and the spinal part of the accessory nerve. The chain of the deep cervical lymph nodes run alongside the vein. Posteriorly, the transverse processes of the cervical vertebrae, the levator scapula, the scalenus medius, the scalenus anterior, the cervical plexus, the phrenic nerve, the thyrocervical trunk, the vertebral vein, and the first part of the subclavian artery. On the left side, it passes in front of the thoracic duct. Medially, above lie the internal carotid artery and the 9th, 10th, 11th, and 12th cranial nerves. Below lie the common carotid artery and the vagus nerve. Tributaries of the internal jugular vein. Inferior petrosal sinus, facial vein, pharyngeal veins, lingual vein, superior thyroid vein, and the middle thyroid vein. Subclavian vein. The subclavian vein is a continuation of the axillary vein at the outer border of the first rib. It joins the internal jugular vein to form the brachiocephalic vein, and it receives the external jugular vein. In addition, it often receives the thoracic duct on the left side and the right lymphatic duct on the right. Relations. Anteriorly, the clavicle. Posteriorly, the scalenus anterior muscle and the phrenic nerve. Inferiorly, the upper surface of the first